What is integrative medicine? It basically denotes the modern attempt to put back the lost pieces of Western medicine. Because, up until the late 1950s, all Western medicine was integrative. If we look back at the original roots, from the time of the early Greeks, we find that Western medicine originally had three branches, or three methods of intervention. The first branch imitates nature by following its wisdom. All symptoms are created by our body's attempt to heal. So if your body is trying to kill off the bacteria that are too out of hand, it will create a fever. So it's important to support that fever. The sniffles and extra mucus of a cold require that you detox with soup, liquid, and rest. So proper hygiene, diet, fluid intake, exercise, breathing, rest, and sleep form the foundation of health, and they are the first logical steps to take at the appearance of symptoms. Natural supportive methods were dropped from the medical curriculum and considered irrelevant after the advent of antibiotics. So this branch, having been abandoned by Western medicine, became what is now called naturopathy. The second method assists the organism to come to a natural homeostasis in its own unique way. It is based on the law of similars, or like cures like. Similars are chosen from nature to match the individual rather than act on symptoms. They are used in very dilute quantities, just enough to stimulate the organism. Pressure from Rockefellers and the pharmaceutical interests caused what is now known as homeopathy to be dropped from the medical curriculum in North America. But homeopathy is still practiced by medical doctors around the world. Let's say that despite these two methods, the body's struggle is such that the symptoms it is creating become life-threatening, such as a high fever that goes too high for too long a time. Then the last resort, when all else fails, is the use of contraries, which go against the natural healing processes and the symptoms associated with them. That is why they have the prefix anti, meaning against. This branch is called allopathy, allo meaning against. An allopathic medicine, such as Tylenol, will suppress your fever, but there are times when that is necessary. The Second World War and the advent of antibiotics bore the belief that killing all the bacteria in the body, including the good bacteria, would cure every disease, and the misbelief that the body's efforts are irrelevant, and therefore the belief that the only kind of medicine required is allopathy. So conventional medicine is now based only on allopathy, the suppression of symptoms. Allopathy was never designed to address the whole person, nor the true cause of disease. Where conventional medicine does miracles is with physical trauma and emergencies. But there is no chronic illness that can be cured by conventional medicine. Now that we realize that antibiotics are not the cure-all we thought they were, many leading-edge medical universities like Harvard are trying to bring back the other parts to complement allopathy. And this is what they call integrative Western medicine. All three branches can and work synergistically and can be used concurrently in order to optimize results. The MISH program is integrative because we teach how to use two methods, homeopathy and naturopathy, in a way to complement allopathy. This is how Western medicine was originally intended to be.